First of all, let me thank the organizing committee to have invited me to attend this historic event for your Sanford School, but having attended a TED lecture is quite an important stuff. So I'm very happy to be here today and to share with you my thoughts about what healing the world means and what healing the world would mean from a global health perspective. So the first thing, when I was told that this is the talk, the theme of this event is healing the world, the first thing that one might think about healing is a disease or it's medicine, it's science and stuff, which is very true. Science is very important. But what I would like to submit to you today is that science is critical, but what really makes the big difference is partnership. And that's what my talk is going to be about. So the first thing I would like to say, let's think about what medicine has been doing in the last 100 years. You know, if you think about new medicine, think about the medicine that have been developed, practically there is no disease today that doesn't have a treatment for it. And this is really critical, even for diseases like HIV, and most of the cancer treatment today have a treatment associated with it. So the science ingenuity has made incredible progress. And this has been a very important thing. On the other thing is we have seen the great improvement in diagnostic tests. Now, you can diagnose a disease in few minutes. You have rapid diagnostic tests, what we call point-of-care technologies, which is when you walk into the clinic and the healthcare workers will just take a drop of your blood and tell you whether you have HIV, malaria, or even COVID, or even Ebola, as we are talking today about it. So this is really has been a great improvement in public health. The other thing has been also in diagnostics, the development of molecular diagnostic has made big progress in identifying and diagnosing cancer at the very early stage that could, in fact, make a big difference for survival of patients. The other thing as a big achievement has been precision medicine. Many of you might have heard about it, and this is the new trend in the medical development and also in the pharmaceutical industry is about precision medicine, which means not only we are targeting a disease, but really thinking about how that particular patient would results or would react to that particular medicine. And this is very important in genetics and in many other potential indications. But the biggest thing that has happened has been vaccine. And vaccine has been the big, great things that have made the biggest, more visible improvement in public health in the last 100 years. If you think about how vaccines have impacted life expectancy. And if you think about 100 years ago, Europe and the Western world, life expectancy was around 35 to 45 years, which doesn't mean that everybody died at 45 years of age, but that was the average. And if you look at today in the Western world, in Europe, particularly North Europe, but even South Europe like Italy, life expectancy has come to 85, 90 years, which is huge. And even in developing countries, even in Africa today, life expectancy, even in Ethiopia, we reach a level of 69, 70 years as life expectancy average, which is quite a lot compared to the 35 years life expectancy of 60, 70 years ago. So there has been a huge improvement in terms of science in the last 100 years. Yet, inequality still exists there. Despite all this great improvement we have seen in science and how this has impacted public health globally, we still have a lot of inequalities in the world. And these inequalities are really access gaps. If we think about it, you know, not everyone in the world has access to all these great improvements in diagnostics, in drugs, in medicine that have been achieved, and not even thinking about vaccination. There are big programs for vaccinating people, but still we are lagging behind. And this is one very big problem. And the other big problem that is still there is high prices of all this medicine. If you just think about in the Western world, in the United States, treatment of cancer today can be as expensive as $150,000 per year. And not mentioning that this treatment is not even available for many patients in Africa. And so these non-communicable diseases, which were the symbol of wealth society, mainly in the West, are now coming in a big way, even in Africa and in the, let's call it, developing world, like diabetes, hypertension, cardiac diseases, etc., and cancer in particular. So high price is really a very big problem in public health, and delayed treatment. And this is about diagnostics. So it has to do with the fact that if you are sick, what you want is to be diagnosed as quickly as possible so that your treatment is not delayed and the outcome can be, can be improved. Now, this has been the big picture. On one hand, you have science that has gone dramatically fast and developing very incredible new things. On the other hand, you have these big gaps that is still dividing the north from the south of the world in terms of public health. So in the year 2000, there has been two things that happened. Let me just go back and just illustrate for you something. In the year 2000, we were in the middle of the HIV crisis in Africa. And that really was happening at the time when it was expiring something that was the World Health Organization big dream, which was health for all by the year 2000, which was meaning that all the countries were committed to improve the health of their population by that specific date, which was the year 2000. Unfortunately, in the year 2000, what we witnessed was that HIV was rampant. So many millions of people were dying out of it. Infectious diseases were out of control. There was no treatment for HIV. There was no treatment for many infectious diseases. So the answer was the creation of what we called public-private partnership. And I was lucky enough, because at that time I was working in the pharmaceutical industry. I was the clinical research director for anti-infectives in the UK, in London. And at that time, it was quite a unique experience because we were the only pharma industry that spent money to develop a new drug for sleeping sickness, which was developed mainly in Africa. It was the first drug approved by the FDA, which all the data, the clinical data, were collected in Africa by African investigators, which was quite a unique story. And on the other hand, I was involved also in the development of new TB drugs, 3 new TB drugs for treatment of TB. And at that time, the Rockefeller Foundation was one of the drivers of this idea of public-private partnership. The idea was the industry is never going to develop something that will be cheap enough to be distributed in countries or that would make an impact in countries because of the price, because of the difficulty of it. So the idea was, can we not put together the experience of the private sector industry with the public need and the public idea and get then the funding for it? And at the very beginning, the funding came from the Rockefeller Foundation. And then after that, I was selected to lead the first foundation, which was the Global Alliance for TB Drug Development in New York. And after that, Bill Gates in 2002 left his Microsoft position to come and lead his foundation, which was at that time Gates Foundation, and the CEO was his father, Bill Gates Foundation Sr. Then when he came, the foundation became Bill and Melinda Gates Foundation, and the overall things changed because the amount of money that he was able to put into the exercise of public health globally was so much that the impact has been dramatic all over the place. So that was in the year 2000 when all these public-private partnerships have been created, mainly funded by the Bill and Melinda Gates Foundation. And 4 of them were quite impressive, was fine. The one that Bill Gates asked me to create in Geneva to develop new diagnostic for TB, which I led for 13 years in Geneva. Then there was the TB Alliance, MMV, the NDI and all this. And all this foundation, they really saved millions of lives. They have been able, MMV developed new drugs for malaria. The TB Alliance developed new drugs for TB. FIND developed new diagnostic for neglected tropical disease. The NDI developed new drugs for sleeping sickness. So the overall of this really has been the impact in terms of life saved has been dramatic. Millions of lives have been saved all over the world. But despite all this, and if we look at the last 25 years, so many new public-private partnerships exist, but still, the innovation is still there. People are still innovating, both from the private sector, from the public sector, from public-private partnership. But the patients are still waiting for this innovation to reach them. And what really is the big story about public-private partnership is about the last mile. How do we make sure that everything that is developed really reach the people that need it in the last mile of access of the drugs? And really this is very important. So as the name of the game in the year 2000 was that we need to create new invention, new tools to make a change in the life of people. Now, the name of the game should be that we need to guarantee access. We need to develop new tools, but we need to be sure that these new tools really reach the people that need it the most, which is not the case until now. And that's what brings me to my point, the idea that I would like to submit for your thinking and for your elaboration is about thinking about how this public-private partnership should evolve in a new thinking around it. And if you think about what a public-private partnership does, is really the first thing is you set the priorities and you think, what is that is needed that I need to spend money on or I need to develop? And that's very important because that should reflect local needs and local diseases and not, priorities should not be set in Geneva by WHO, by UN, by big organizations, should be set priorities in the countries and should reflect what patients need and what real needs in the country are. And then the second part of the equation is the tools. So you identify a disease as a priority, sleeping sickness, for example, and then you understand that for that disease, what we need is a new diagnostic tool. Then you think about how that tool will have to be developed. And then you think about a discovery program that would fit into that need. And that should be, again, as much as possible, should be local. And then it comes to the real big point, which is the matter of what public health and global health issue is today, is about manufacturing. So the production should be very near as possible to patients. So we have been seeing most of the production happens in the Western world, happens in America and under patent protection in Europe. And then now more and more is coming in India and China. But Africa, for example, is still lagging behind very much on this. And there is a very important need to have local production, to be starting also in Africa to make sure that drugs are manufactured as near as possible to where the disease is and where the patient lives. And then we would like to see that this industry, this pharmaceutical industry, or whatever it is, this industry should also stay local as much as possible and grow local. And why is that? How this would translate into impact for everyone living in the country. First of all, is that when you expand this model, you will expand discovery. So it means that government will have also to put money into discovery, into research and development local. And if you start producing locally, also the price of your goods should also become lower than what it is then from importing from outside. And the access to patient will be faster because what you are producing is very near to where they live and where they have their disease. So the whole idea about this new way of looking at public-private partnership, which was a two-way until now, which was government and private. So government was mainly very timidly represented by African government. African government never put money into public-private partnerships, so the government putting money were always the same, and most of these few Western European countries and the US that we all know now suddenly have stopped all their support in that respect. So, and these were the two things. And the government, so in the middle, the Bill and Melinda Gates Foundation and other funding partners were in the middle between public and private. So by setting priorities, they were playing the role of government, which they weren't. And the private was also in terms of being involved in the private sector because they had very preferential relationship with industry and funding much of the research for developing of new tools. So how do we imagine this idea? Now, please try to imagine this one from two actors. Now what I'm submitting, and I will publish this idea very soon, is about, it's have four actors. One is the government in the countries, and the government set priorities, which say, no, we don't need a malaria drug, we need a sleeping aid, just to make an example, but setting priorities is the role. And then the industry. And the second partner is the industry. And the industry doesn't need to be the big industry like we understand now. The big research company can be the local industry in the country that should be funded by government to do research and development in the countries. The third actor should be philanthropy. And we still need the Bill and Melinda Gates Foundation. We still need their billions because it is very critical, because to get all this started, governments don't have much of the money, especially when we look at research and development. And so what we are asking philanthropy is to move out from the very sexy spot that they have been using so far, which is to be available always at the last mile, just, in the implementation phase. But take more risk into the research and development of tools. Put money into the research of new tools. And do that in partners with government. And the last one, the last partner in these four things that I have in mind are countries. And when I talk about countries, it's not governments only. Government is very important, but countries is even more important. And countries here, in my idea, is about civil society. And civil society is patients themselves that have a voice, and they have to express that voice and make that voice heard. So to close my talk, I want to undermine one thing, that health is a human right, just like any other human right. Every individual in the world, wherever he's born here or born anywhere in the world, has the right to health. And that is a very important thing. So what we can say is that science should create the possibility, but it's only and mainly partnership that can make it universal. Thank you for your attention.